I'll shift gears a little bit and transition to something else. One of the thing is, we know early stage melanoma, the cure is relatively straightforward, standard excision. But at the same time, a lot of times that patient always have those kind of fear. And you have this wonderful bedside manner, and I hear it again and again when we share the patients together. What do you tell those patients? How do you comfort and alleviate their fear?
That's a matter of personal style and communication, as you well know. There's no one size that fits everyone. But I think when patients realize that they've come to see a member of a team, and it's a member of a team that includes you as a dermatologist and an expert dermatopathologist, and an expert radiologist, expert medical oncologist if necessary, but also the anesthesia team. I mean, I look at this whole team, and once they realize, my personal feeling is once they realize that they're in a place where you know pretty much everything there is to know about their problem, their anxiety, at no matter what stage, whether it's early stage or late stage, decreases because they can offload that onto us. They can understand as much as they can. I've spoken to so many patients with the most difficult problems who wanted to understand and take part in their care, but realized at some point they would have to rely on either my knowledge or, in the absence of knowledge, they'd have to rely on my judgment or the judgment of our team as we worked together to try to come up with a solution. And I think as you know, you talked about the melanoma disease management team that I've been privileged to work with. It's an incredible privilege to take a problem that you're just not sure what to do in front and just take 15 minutes to discuss it among highly respected peers in each discipline, whether it's radiation or dermatology or medical oncology. But you're not asking them for a solution, but you're coming together with a rational approach to a problem. This also really extends, you talked about early melanoma, to ambiguous lesions in pathology. You've biopsied 1,000 moles when the pathologist has come back and said, I just can't tell what this is.
Yep.
That's not enough, quite honestly, in this day and age. Our pathologists meet together and review these ambiguous lesions. And they may not know the answer, but they will tell us what they're worried about. Or I think this is a melanoma. I think this is not a melanoma. Obviously, lots of new techniques in pathology that help them sort of nudge them one way or another. But I think, to answer your question directly, it's probably less my personal style than it is conveying to them that they are in the right place and that we have resources that we can really bring to bear to help them solve their problem, or at least manage their problem if we can't solve it in the best possible way. And that's a rare privilege to have worked at Sloan Kettering, as you know, where you just had, if you didn't know the answer, you knew somebody who did.
Yeah, I think I remember those Fridays, the disciplining team, and we had in the dermatology, we had those sessions as well. Pathology had those sessions as well. It's always a team-based approach to solve really difficult cases.